2:47 a.m. Eastchester Road, the Bronx. The Riverbend Geriatric Care Pavilion sits quiet under a low October sky, its tan brick facade still wet from overnight rain. A delivery truck idles near the loading dock. A single nurse smokes outside the side entrance, her scrubs pale blue under the sodium lights. Inside, 342 elderly residents are sleeping. Some will not wake to the world they went to bed in. At 4:48 a.m., the smoking nurse looks up. Black SUVs come around the corner from Waters Place. Not 2, not 5, 14. They move in a single, coordinated line, headlights off, and behind them roll 2 armored tactical vehicles bearing the seal of the Federal Bureau of Investigation. From the south, a second column approaches. Drug Enforcement Administration, New York Field Division. From the north, a third. Health and Human Services, Office of Inspector General. Department of Homeland Security investigators bring up the rear. The nurse drops her cigarette. She turns to run inside. She does not make it to the door. By 4:51 a.m., every exit of the Riverbend Geriatric Care Pavilion is sealed. Federal agents in full tactical kit are flowing through the lobby, the medication rooms, the administrative wing on the 3rd floor. They are not here for a routine inspection. They are not here on a tip about Medicaid overbilling or improper staffing ratios. They are here because the United States Department of Justice has just unsealed a 247-count indictment. And what they will find inside this building over the next 11 hours will become the largest healthcare fraud and controlled substance trafficking case in the history of the state of New York. That is the figure United States Attorney Damian Williams will read into the microphone at 2 p.m. that same afternoon, standing at a podium at 1 St. Andrews Plaza, his voice flat and exact. $1.8 billion in fraudulent Medicare and Medicaid claims, tens of thousands of diverted opioid prescriptions, a criminal enterprise that operated undetected for nearly 9 years inside a facility entrusted with the most vulnerable people in our society. But to understand how we got there, we have to go back. Not to last week. Not to last year. We have to go back to 2016. His name is Dr. Aaron Mendelsohn, 61 years old. A licensed physician in the state of New York since 1991. A graduate of Columbia University College of Physicians and Surgeons. The author of 3 books on geriatric care ethics. The recipient, in 2019, of the Bronx Borough President's Humanitarian of the Year Award. If you searched his name on the morning of the raid, you would have found photographs of him reading to elderly residents in a wood-paneled common room. You would have found a 2021 NY1 segment praising Riverbend as a model of compassionate end-of-life care. You would have found his TEDx talk, Dignity in the Final Decade, which has been viewed over 400,000 times. What you would not have found until 4:48 am on that October morning was the name Aaron Mendelsohn on a federal indictment alleging healthcare fraud, wire fraud, conspiracy to distribute controlled substances, money laundering, identity theft, and the abuse and neglect of incapacitated adults. 22 counts. Maximum exposure, 240 years. Agents found him in his office on the 4th floor at 5:14 a.m. He was already dressed. He was already at his desk. According to the arresting agent's affidavit, he did not appear surprised. He asked for his attorney, then for a glass of water, then said nothing else. Behind him, on a bookshelf, sat a framed quote from Cicero in Latin, Salus agrodi suprema lex. The welfare of the patient is the supreme law. Agents would later seize that bookshelf. Behind it, embedded in the drywall, they would find a safe. Inside the safe, $847,000 in cash, 3 unregistered firearms, and a USB drive containing what the indictment describes as the operational ledger of the entire scheme. The answer, federal prosecutors will allege, is that it survived because it was never just one fraud. It was 3, running in parallel, each reinforcing the other, each laundering the suspicions raised by the others. The first was billing fraud, standard, almost mundane in its execution. Riverbend submitted Medicare and Medicaid claims for medical services that were never rendered, physical therapy sessions for residents who were bedridden, psychiatric evaluations for residents in vegetative states, wound care treatments for wounds that did not exist. Investigators identified 41,000 fraudulent service claims spanning the period from January 2016 to September 2025. total billed approximately $312 million. The second was the ghost roster. Riverbend's official census, as reported to state regulators and federal reimbursement programs, listed an average daily population of 487 residents. The actual physical population, agents determined within 48 hours of the raid, never exceeded 350. The remaining 137 residents existed only on paper, fabricated identities, deceased patients whose deaths were never reported, and, in at least 62 documented cases, the stolen identities of living elderly people who had never set foot in the facility. For each ghost resident, Riverbend collected a daily reimbursement rate of approximately $412. Multiply that by 137. Multiply that by 365. Multiply that by 9 years. That is approximately $185 million. But the third scheme is what brought the DEA to Eastchester Road that morning. The third scheme is what transforms this case from a financial crime into something far darker. Every nursing home in the United States is authorized to maintain a controlled substance inventory for the legitimate management of chronic pain in its residents. Oxycodone, hydrocodone, fentanyl patches, morphine sulfate. These medications are tightly regulated, individually logged, and subject to quarterly audit by the Drug Enforcement Administration. At Riverbend, the audits always came back clean. Every pill accounted for, every patch logged, every signature in place. The signatures were forged. Beginning in approximately 2017, according to the indictment, Dr. Mendelsohn directed his nursing staff to write prescriptions in the names of residents, both real and ghost, for controlled substances those residents would never receive. The actual medications were diverted. They moved out of Riverbend through a network of pharmacy technicians, transport drivers, and street-level distributors operating in the Bronx, Queens, and northern New Jersey. DEA investigators estimate the total volume diverted from Riverbend Geriatric Care Pavilion between 2017 and 2025 at more than 2.3 million dosage units of Schedule II controlled substances. The street value, according to DEA New York Field Division, approximately $1.3 billion. Added together, the billing fraud, the ghost roster, the diverted opioids, $1.8 billion. You cannot run a scheme like this with one man. In the indictment, prosecutors named Dr. Mendelsohn alongside 29 licensed nurses, 4 pharmacy technicians, 2 facility administrators, and 1 consulting physician who served on Riverbend's medical advisory board. Each was arrested in the early hours of October the same morning in coordinated raids spanning 4 states. They were not, federal investigators are careful to emphasize, all equally culpable. Some forged signatures. Some looked the other way. Some, the indictment alleges, were threatened into compliance, told that reporting irregularities would result in the loss of their license, their job, their ability to feed their families. Riverbend held the H-1B visa sponsorship for 11 of the arrested nurses. The leverage was not subtle. But 7 of the 29, according to wiretap evidence, were active participants. They received cash bonuses of between $4,000 and $11,000 per month, paid through shell companies registered in Delaware and the British Virgin Islands. They knew. They profited. And in at least 3 documented cases, they administered placebos, sugar pills, saline injections to residents whose actual prescribed medications had already been diverted that morning. Residents who, in some cases, died of preventable pain. The indictment includes the names of 47 deceased Riverbend residents whose end-of-life care, federal prosecutors will argue at trial, was actively compromised by the diversion scheme. Their families learned the truth from a press release, not by an audit, not by a regulator, not by a state inspection. It was discovered by a 19-year-old pharmacy technician named Maria de la Cruz, who had worked at Riverbend for 4 months when she noticed that the same patient, a Mr. Theodore Holloway, age 84, had received 17 separate fentanyl prescriptions in a single 30-day window in February 2024. She mentioned it to her supervisor. Her supervisor told her to mind her own work. She did not mind her own work. In March 2024, Maria de la Cruz walked into the FBI New York field office at 26 Federal Plaza and asked to speak with someone about Medicare fraud. She brought with her 73 pages of photocopied prescription records. She was assigned to Special Agent Rachel Yoon, a 14-year veteran of the Bureau's Healthcare Fraud Unit. By the end of that week, the case had been opened. By June, a federal grand jury had been impaneled in the Southern District of New York. By August, undercover agents were operating inside Riverbend as temporary contract nurses. By September, financial investigators from the Treasury's Financial Crimes Enforcement Network had traced the shell company structure back through layers of nominee directors to a single beneficial owner. Aaron Mendelsohn. Maria de la Cruz, you should know, did not appear at the press conference. She does not appear in any of the photographs. Her name appears, redacted, in exactly one paragraph of the unsealed indictment, identified only as Confidential Witness 1. She is, at the time of this filming, in protective relocation. She will remain there for the foreseeable future. She is the reason the building is now sealed with federal evidence tape. Within 72 hours of the raid, the State of New York Department of Health revoked Riverbend's operating license and initiated emergency transfer proceedings for all 342 surviving residents. The transfers were not simple. Many of these patients had advanced dementia. Many had no surviving family. Many had been at Riverbend for over a decade. By the end of the first week, every resident had been placed in a licensed facility elsewhere in the metropolitan area. 6 died during the transfer process. None, according to medical examiners, from acute medical neglect. But the question of contributing factors remains under review. The civil litigation began before the criminal cases were even arraigned. As of this recording, 23 separate wrongful death suits and 1 federal class action have been filed against Riverbend. Dr. Mendelsohn personally and the corporate parent entity, Eastchester Holdings, LLC. The combined claimed damages exceed $4 billion. Eastchester Holdings filed for Chapter 11 bankruptcy protection 11 days after the raid. Dr. Mendelsohn was denied bail at his initial appearance. The presiding magistrate, Judge Ona Wong, cited the cash and firearms recovered from the office safe, the foreign asset structure, and what she described as a sustained pattern of premeditated cruelty toward incapacitated victims in her ruling. He remains in federal custody at the Metropolitan Detention Center in Brooklyn, awaiting trial. The trial date is set. Because Riverbend is not unique. Because the Department of Health and Human Services Office of Inspector General estimates that healthcare fraud costs American taxpayers approximately $100 billion every year, and a substantial fraction of that fraud occurs inside long-term care facilities serving the elderly. Because the system's designed to detect this fraud, the audits, the inspections, the licensing reviews were all in place at Riverbend. They all worked exactly as designed. And they all missed it. For 9 years. Because in the end, what stopped Aaron Mendelsohn was not a regulator. It was a 19-year-old pharmacy technician who refused to mind her own work. Ask yourself, how many Aaron Mendelsohns are still operating? How many ghost rosters are being submitted to Medicare this morning? How many elderly residents somewhere in this country are being given a sugar pill instead of the medication that bears their name? We do not know. The investigators do not know. That is the frightening part. What we know is this. United States Attorney Damian Williams, at the close of the October press conference, looked into the cameras and said, in a tone barely above a whisper, to anyone running a scheme like this, anywhere in this district, understand that we are coming. To anyone who suspects something, anywhere in this country, understand that we will protect you. And to the families who trusted Riverbend with the people they loved most, we are sorry. We were too slow. We will be faster next time. He did not take questions. At 3:47 p.m. on the day of the raid, nearly 11 hours after the first SUV turned onto Eastchester Road, federal agents were still removing evidence from the Riverbend Geriatric Care Pavilion. Bankers' boxes, hard drives, paper-bagged firearms, a safe wheeled out on a hand truck requiring 4 agents to move it. And as the last evidence vehicle pulled away from the loading dock, one of the residents, a woman, 91 years old, in a wheelchair, wrapped in a hospital blanket against the October chill, was being lifted into a transport van for relocation to a facility in Yonkers. She did not understand what was happening. She had been told by a nurse she did not recognize that she was going on a trip. She was holding, in her lap, a framed photograph from her room. A photograph of her late husband. She looked up at the building she had lived in for the last 7 years. She looked at the federal seal on the door. And she said, to no one in particular, is the doctor coming with us? If this story moved you, if it angered you, if it made you think about someone you love who is in a facility, somewhere, right now, trusting the people who are supposed to be caring for them, then do this one thing. Call them. Today. Visit them. This week. Ask questions. Read the medication logs. Be the person who refuses to mind their own work, because the next Maria de la Cruz, the next Special Agent Yun, the next 447M raid, that all begins with someone, somewhere, who simply paid attention. Pay attention. The vulnerable are counting on it.